The boundary between cancer therapy and regenerative medicine is rapidly blurring, and nowhere is this more evident than in the emerging strategy of repurposing anti-cancer drugs like RG-7112 for chronic, non-lethal conditions such as degenerative back pain. Originally developed to induce apoptosis in cancerous cells, RG-7112 is a potent small molecule inhibitor of MDM2, a protein that suppresses the activity of p53, a key tumor suppressor involved in regulating cell cycle arrest and programmed cell death. In cancers with wild-type p53, blocking MDM2 unleashes p53's ability to trigger apoptosis in cells that have acquired excessive damage. But the same pathway is also implicated in cellular senescence, making drugs like RG-7112 potentially valuable in eliminating dysfunctional, aging cells that accumulate in tissues like spinal discs, joints, and tendons. In intervertebral disc degeneration, senescent cells accumulate in the nucleus pulposus and annulus fibrosus due to aging, mechanical stress, oxidative damage, or metabolic dysfunction. These cells enter a state of irreversible growth arrest but remain metabolically active, releasing a toxic mix of cytokines, chemokines, and matrix-degrading enzymes, collectively known as the SASP. Senescence-associated secretory phenotype. This inflammatory cocktail degrades extracellular matrix proteins, sensitizes surrounding nerves, and inhibits regeneration. Over time, the disc becomes dehydrated, structurally weakened, and functionally compromised, contributing to chronic low back pain and spinal instability. RG-7112 and similar MDM2 inhibitors are now being investigated for their ability to selectively trigger apoptosis in senescent cells. By restoring p53 activity, these agents push damaged cells beyond a survival threshold into programmed cell death. In the context of cancer, this clears malignant clones. In aging tissues, it may clear zombie cells that perpetuate inflammation and degeneration. Preclinical studies in musculoskeletal models have shown that MDM2 inhibition can reduce the senescent cell burden in cartilage, muscle, and spine tissues, resulting in improved structure, reduced inflammation, and restoration of function. The idea of re-engineering these drugs for degenerative disorders is not just theoretically elegant, it is biologically sound. Senescent cells are characterized by high levels of anti-apoptotic signaling, which allows them to survive despite being dysfunctional. Senolytic drugs work by exploiting this survival dependency. RG-7112 fits this profile well, as many senescent cells rely on MDM2-mediated suppression of p53 to avoid self-destruction. By blocking this pathway, RG-7112 tips the balance toward apoptosis, selectively removing senescent cells while sparing healthy ones. This targeted mechanism is especially attractive for chronic conditions where systemic toxicity must be avoided and localized. Infrequent dosing is preferred. However, using a potent anti-cancer drug in non-cancer contexts requires careful recalibration. The goal is not to obliterate all dividing cells, but to fine-tune apoptosis in specific senescent populations. Lower doses, modified delivery routes, e.g., intradiscal injection, and improved selectivity are all active areas of research. Toxicity remains a concern. MDM2 inhibitors like RG-7112 can cause transient bone marrow suppression or gastrointestinal side effects in cancer patients, and these risks must be minimized in otherwise healthy individuals with chronic back pain. Advances in drug delivery, such as nanoparticle encapsulation or hydrogel-based local release, may help overcome these challenges by limiting systemic exposure. Interestingly, the musculoskeletal system may be particularly suited to senolytic repurposing because its key structures, cartilage, discs, tendons, are poorly vascularized, making localized treatment both feasible and impactful. This stands in contrast to cancer or metabolic diseases, which often require systemic drug exposure. Local application of re-engineered senolytics could offer a way to eliminate senescent cells, dampen inflammation, and promote endogenous repair, all without resorting to spinal fusion or artificial implants. Another area of promise is in combination therapy. Senolytic treatment with RG-7112 analogs could precede or coincide with regenerative interventions, such as stem cell therapy, platelet-rich plasma, or growth factor injections. By clearing senescent cells first, the tissue environment becomes more receptive to regeneration, free from the inhibitory signals of the SASP. This sequence mimics the body's own healing logic, remove the damage, then rebuild. Repurposing anti-cancer drugs like RG-7112 for age-related, non-malignant disorders represents a powerful conceptual shift in medicine. It acknowledges that the hallmarks of aging, particularly senescence and chronic inflammation, are not just background noise but active drivers of disease, even in the absence of malignancy. Back pain, often seen as an inevitable consequence of age, may in fact be a treatable, reversible condition at the cellular level. While much work remains to refine dosing, safety, and delivery, the principle is bold and exciting. The tools built to fight cancer may also hold the key to restoring the aging spine, not by replacing tissue, but by intelligently clearing the cells that hold it back from healing.